As you know, the urbanization is on rise globally, and Nepal is not an exception. And recent living standard study indicated that 17% of our population are living in urban area. Among them, 9% are still practicing agriculture, and that's more true in Bhaktapur, the city, which peri-urban area, which used to be very much famous for agriculture background. But there are still a lack of data showing the engagement of agriculture sector and its effect on food security and also on child and mother nutrition. So the conceptual framework, it has been shown before also. There are many pathways which can affect the engagement of nutrition to the mother and child health due to different pathways. So the study is actually follow-up study. The original study we have carried out among 500 households where children living less than 1 year of age. And after 5 years, we could collect data from 344. And the age group is, the children are 44 to 79 months. So the age group is a little bit different than you will see the other indicator. But the tools, outcome measures we have been used is very much familiar. That's food security, HFIS score. That's from FAO and FANTA project. We have been discussing lots regarding these tools. And we have been looking nutritional status of mother and children. And our exposure is, we are analyzing data, the engagement of agriculture versus the family which are not engaged in agriculture work. So this HFIS score, that's a different domain we are analyzing. It could be intake, quality, or anxiety score domain. And first, we are asking whether the problem exists in the family or not. Then we are asking how frequently that problem in the family in last 6 months. Then we also analyze household dietary diversity score. And we have been collecting 24-hour dietary call also. And, we are calculating dietary diversity score in family from women and from child as well. So livestock, we also had a question on livestock. It's not surprisingly, it's peri-urban area, so we haven't seen much livestock in household except the chicken. That's those household which responded, they are having livestock. It's mostly the chicken. So as I have mentioned, we have asked how much the agriculture farming in last year in the household. So it's not surprisingly, rice is the most common, followed by wheat and maize. And then, still it's very common to have lots of seasonal vegetables grown in our area. So you can see the families are practicing different type of vegetables. And in this slide, I want to show the difference between agriculture, household which are engaging agriculture sector versus those households which are not engaged in agriculture. You can see the rate of stunting, underweight. That's those who are engaging in agriculture sector. They are having a lower prevalence of stunting as well as underweight. And we haven't seen the difference in maternal BMI and maternal hemoglobin, but the finding higher BMI is very much striking. That's reflect our growing problem of overweight. We are having in peri-urban area, maybe the age group is older in our sample, so that's also one of the reasons we are seeing very different than the national data. I think the 2016 data indicated it's about 22% overweight in urban area. So we are having a little bit more than that, but that's because of our age group and urban setting. And then we also, you can see here, the previous slide was just crude analysis. Here we have adjusted for possible confounding, like wealth, their income, their perinatal history, and some other confounding variables. You can see, the outcome for underweight is borderline significance, but for stunting, it's very highly significant. Those who are engaging, cultivating agriculture, they are having in that household, we've found that the stunting is substantially lower. So if you see the different domain of food security also, here also we see that those families which are engaging in agriculture household, we are having, they are more food secure. You can see in this slide different domain of food security HFIS questionnaire that's reflect here. And when we analyze with adjusting other confounding variable also, the relationship is still consistent. So for each additional month of rice sufficiency, that's rice is more more common in our household. The risk of moderate or severe food insecurity also dropped by 16%. So that's also very important finding in our context. So in conclusion, as we have been discussing lots on stunting and food security in our area, especially in peri-urban area where agriculture, farming, cultivation are decreasing day by day, and our finding highlight that still it's very important in order to secure household food security, as well as focus on the child malnutrition, especially stunting. As expected, we haven't seen very much relationship with livestock, contrary to the many research from especially from Helen Keller in rural area. It's just because the study site is not so much having different livestock, and our finding is also very much in same direction that some of other recent systematic review also indicating that even in peri-urban area, agriculture cultivation is equally important in order to have good food security in a household, and as well as improve nutritional status of mother and children. Thank you.